Ghaith Prometric Exam Questions and Answers, Part 9. A 36-year-old man presented to the hospital with complaints of breathing, difficulties, and fever. The patient had undergone a liver transplant 1 year before. Upon assessment, a yellowish colored skin was noted on entire body. The heart rate is 102, RR is 29, BP is 110/80, the temperature is 39.2. Which complication is most likely to occur? A. Bleeding. B. Embolism. C. Superinfection. D. Organ rejection. The answer is D. Organ rejection. The complications of liver transplant rejection: a high temperature of 38 degrees Celsius or above, jaundice or yellowing of the skin or eyes, pain in your abdomen, feeling hot and shivery, shortness of breath, vomiting, and diarrhea, severe headache. A 23-year-old patient was admitted to evaluate in pyrexia of unknown origin. According to her mother, her fever spiked every night to 38.5 until morning of the last 2 weeks. The patient was quiet, uninterested in her surroundings, had language barrier, and her personal hygiene was not maintained. At lunchtime, she refused to eat the hospital food, but he yelled at her in front of others and forced her to eat. What basic need of the patient is disturbed according to the Maslow hierarchy of needs? A. Self-esteem. B. Self-actualization. C. Safety and security. D. Food, water, and shelter. The answer is A. Self-esteem. A 42-year-old man with thalassemia received a packed cell transfusion. The nurse assessed the stability of his condition after transfusion by monitoring the vital signs and general condition every 2 hours. When should the nurse immediately report the patient's condition? A. Severe headache and raised blood pressure. B. Raised body temperature and flushed skin. C. Joint pain, body aches, and restlessness. D. Restlessness and bradycardia. The answer is B. Raised body temperature and flushed skin. The symptoms can you have after a blood transfusion: fever, hotness of the body and chills, dizziness, shortness of breath, itching, hypothermia, back pain, low blood pressure. A patient with severe varicose veins of the left legs presents to the clinic. The patient states that 3 days ago, the right leg became very swollen and the skin in the right calf area are very darkly colored. The capillary refill in the fingers is 3 seconds and on the right toes is 4 seconds. A. Teach the patient self-blood monitoring. B. Assess the patient to sided heart failure. C. Encourage the patient to joint exercise class. D. Teach the patient how to apply thigh-high anti-embolic stocking. The answer is D. Teach the patient how to apply thigh-high anti-embolic stocking. A woman delivered her baby boy 3 hours ago with caput succedanum. Which of the following the nurse expects to find when she examines the newborn baby caput? A. Soft, fluctuant mass filled with fluid. B. Bilateral mass on both biparietal bones. C. A mass with clear edges that end at the suture lines. D. A hard mass that is filled with blood. The answer is A. Soft, fluctuant mass filled with fluid. When caring for a client who has acute respiratory distress syndrome, a nurse elevates the head of the bed to 30 degrees. What is the reason for this intervention? A. Reduce abdominal pressure on the diaphragm. B. Promote bronchodilation and effective airway clearance. C. Decrease pressure on medullary center which stimulates breathing. D. Promote retraction of intercostal accessory muscle of respiration. The answer is A. Reduce abdominal pressure on the diaphragm. Fowler's and semi-Fowler's position is recommended for respiratory distress syndrome. Respiratory changes result in increased oxygenation by maximizing chest expansion, minimizing abdominal muscular tension, and minimizing the effects of gravity on the chest wall. A nurse need to take the temperature of an adult comatose patient, his rectum. How far into the rectum should the thermometer be inserted? Reliable temperature. A. 1.5 centimeters. B. 2.5 centimeters. C. 3.5 centimeters. D. 4.5 centimeters. The answer is C. 3.5 centimeters. A 40-year-old client underwent an exploratory laparotomy with anesthesia. An assessment of abdominal 36-hour postoperative showed abdominal distension and absence of bowel sounds. Which complication is most likely? A. Paralytic ileus. B. Hemorrhage. C. Rupture of the colon. C. Intussusception. The answer is A. Paralytic ileus. What is an ileus complication of abdominal surgery? Postoperative ileus describes as deceleration or arrest in intestinal motility following surgery. It is classified as functional bowel obstruction and is very common, particularly after abdominal surgery or pelvic orthopedic surgery. A patient with carpal tunnel syndrome or CTS is being prepared for surgery. Which of the following appropriate to delegate to assistant? A. Assess wrist and hand of patient for discoloration. B. Assist patient with self-care activities such as bathing. C. Check digits of the hand for painful tingling sensation. D. Initiate application of splint for immobilization during the surgery. The answer is B. Assist patient with self-care activities such as bathing. A nurse in the medical surgical unit is reviewing a plan of care for the elderly client with chronic obstruction, pulmonary disease, COPD, limited mobility. The nurse notes that the physical therapies change in the plan of care to progress ambulation from 50 to 100 times a day. Which action is necessary to ensure that the client's needs are? A. Inform physical therapies of client respiratory status before progressing to ambulation. B. Instruct physical therapists not to proceed with ambulation nurse presence. C. Inform physician about physical decision to ambulation. D. Cancel referral to physical therapist. The answer is A. Inform physical therapists of client's respiratory status before progressing to ambulation. A 7-year-old child is assessed with urinary tract infection. The BP is 99/55, temperature is 36.4. Which of the following is the most appropriate nursing action? A. Notify the physician immediately. B. Notify the nurse manager immediately. C. Document the findings in the nurse note. D. Put the patient in Trendelenburg position. The answer is C. Document the findings in the nursing note. The physician writes the following order: vancomycin 500 mg intravenous injection. The infusion is to be mixed with 200 ml of normal saline and administered through a central line. The nurse ordered the medication from the pharmacy, which, reviewing the chart, the nurse notes the patient has penicillin allergy. A. Withhold the medication and notify the physician. B. Suggest an additional order for antihistamine. C. Dilute in 500 ml prior to administration. D. Administer the medication as ordered. The answer is D. Administer the medication as ordered. Tetracyclines, example doxycycline, quinolones, example ciprofloxacin, macrolides, example clarithromycin, aminoglycosides, example gentamicin, and glycopeptides, example vancomycin, are all unrelated to penicillins and are safe to use in the penicillin allergic patient. A 55-year-old underwent total hip replacement. 2 hours post-operative in orthopedic unit, the nurse notes that the patient has lethargy and dizzy. The hemoglobin is 9.8. The normal is 13 to 17. What nursing intervention is the most appropriate? A. Start IV fluids. B. Administer paracetamol 1 gram IV. C. Cold blood bank and request 1 unit of PAC RBC. D. Encourage ambulation to reduce enhanced recovery. The answer is A. Start IV fluids. While evaluating a child in the emergency department, the nurse notices manifestation of feeling warm to touch. The patient has bluish nail beds and bluish lips. Which of the following should the nurse immediately assess? A. Respiration. B. Temperature. C. Pulse. D. Blood pressure. The answer is C. Pulse. A nurse is caring for a client with syndrome of inappropriate antidiuretic hormone or SIDH. Which of the following should be a priority intervention for this client? A. Monitoring hourly intake and output. B. Pressure ulcer prevention strategies. C. Encourage client to eat food rich in potassium. D. Restricting fluid intake of the client to less than 1,000 ml per day. The answer is D. Restricting fluid intake of the client to less than 1,000 ml per day. Remember these keynotes. For SIDH or syndrome inappropriate antidiuretic hormone, soak inside. So water retention inside the body. While the diabetic insipidus, DI or dry inside or less water inside the body, most of the water are going out from the body. A 75-year-old man is pale and lethargic. He weighs 105 kg and is bedridden with urine and stool incontinence. Which of the following is the appropriate nursing diagnosis? A. Risk for falls. B. Risk for infection. C. Risk for fluid imbalance. D. Risk for impaired skin integrity. The answer is D. Is risk for impaired skin integrity. A patient who had abdominal surgery 6 days ago has been ambulating in the halls without much difficulty. However, on 7th post-operative day, the patient complains of increased pain at incisional site and is walking bent over. What is the most likely cause? A. Intestinal inflammation. B. Pulmonary edema. C. Wound infection. D. Deep vein thrombosis. The answer is C. Wound infection. A clinical instructor was explaining to his students about the discharge planning. One of the students asked about the timing of initiating the discharge planning. A. When patient asked for discharge. B. On admission to acute care setting. C. After successful recovery from surgery. D. When the treating physician agreed to discharge. The answer is B. On admission to acute care settings. When in-hospital discharge planning is done, ideally discharge planning starts as soon as you are admitted to the hospital, and ideally it also involves you and your family as well as the hospital staff. The process of discharge planning prepares you to leave the hospital. It should begin soon after you are admitted to the hospital. A nurse is completing the pre-operative assessment of the patient who is scheduled for vein ligation and stripping. The nurse should explain that which of the following is included in the patient post-operative plan of care. A. Apply cold packs. B. Wearing elasticized stockings. C. Ambulating with auxiliary crutches. D. Participating in physical therapy. The answer is A. Apply cold packs. A patient was admitted to the emergency room due to abdominal pain. Upon assessment, positive psoas sign was noted. The patient was rushed to the operating room for stat appendectomy. Before a nasogastric tube is removed post-operatively, A. Patient feels hungry. B. Upon patient request. C. Flatus reported by the patient. D. Patient consciousness is regained. The answer is C. Flatus reported by the patient. During the initial assessment, a registered nurse decided to do apical pulse for a patient with coronary artery disease. Which position is best for the patient to be placed to measure the pulse? A. Prone position. B. Supine position. C. Position on his or her left side. D. Position on his right side. The answer is B. Supine position. Which of the following intervention is appropriate for the diagnosis of risk for injury of patient that has a pacemaker? A. Offer back rubs to promote relaxation. B. Instruct patient in dorsiflexion exercises of ankles. C. Have patient avoid exposure to magnetic resonance imaging. D. Observe incision site for the redness, purulent, drainage, worm, and soreness. The answer is C. Have patient avoid exposure to magnetic resonance imaging. A patient is brought to the emergency department suffering from inhalation. On assessment, a nurse observed that the patient is aggressive and confused. Which of the following is the most likely explanation? A. Pain. B. Mania. C. Anxiety. D. Hypoxia. The answer is D, hypoxia. A patient has hip fracture, complaining of severe pain. The nurse finds no analgesic was ordered. She calls the orthopedic doctor by telephone and receives a medication order. What is the most appropriate nursing action to ensure correct and medication orders taken? A. Write down the order and get pharmacy supply. B. Write down the order and get medication immediately with another registered nurse. C. Get another registered to witness. Write down the order and read back to the doctor. D. Write down the medication and after serving, get the doctor to witness. The answer is C. Get another registered nurse to witness, write down the order, and read back to the doctor. A 9-year-old child is admitted to the post-operative care unit following heart transplant. The nurse administers cyclosporine by intravenous infusion. 15 minutes later, the child has difficulty breathing. His skin feels cold and clammy and he appears restless. Which of the following is the most appropriate initial nursing action? A. Ensure airway patency. B. Administer oxygen therapy. C. Discontinue intravenous infusion. D. Administer intramuscular epinephrine. The answer is C. Discontinue intravenous infusion. A 56-year-old present to the emergency department experiencing left side's eye discomfort for the past 3 hours. The left eye was blurred while vision in the right eye remained intact. Examination showed increased intraocular pressure in the left eye pupil of the left also reacted slowly to light. Which is the most likely health problems? A. Detached retina. B. Macular hole. C. Glaucoma. D. Cataract. The answer is C. Glaucoma. The two conditions affect two different areas of the eye. Glaucoma involves eye pressure or increased intraocular pressure due to the fluid buildup in the eye, causing damage to the optic nerve at the back of the eye, while cataracts involve protein clumps forming on the lens located at the front of the eye. The cataracts are usually painless and progress gradually, while glaucoma, on the other hand, can be both slow and subtle or painful and quick. A patient is admitted to the emergency department with broken nose and no other facial fractures or injuries. What category of surgery would repair a broken nose fall under A. Urgent, B. Elective, C. Emergency, D. Immediate? The answer is B. Elective. During nursing assessment, the nurse documents the presence of skin breaks, abrasions, blisters, edema, and infection. According to recognized staging system, what is the classification of this pressure ulcer? A. Stage 1, B. Stage 2, C. Stage 3, D. Stage 4. The answer is B. Stage 2. Which one of the following is the reservoir for the pathogens causing hepatitis C? A. Blood, B. Bowel, C. Bladder, D. Bronchioles. The answer is A. Blood. Which of the following can be considered as a major development in nursing home visits in terms of informative technology? A. Medication dispensing, B. Telehealth, C. Patient monitoring, D. Prevention of epidemiological disease. The answer is B. Telehealth. Which of the following contraceptive methods offer protection against sexually transmitted infection? A. Coitus interruptus, B. Intrauterine device, C. Latex condom, D. Oral contraceptive. The answer is C. Latex condom. Which of the following risks can be determined by alpha-fetoprotein analysis screening tests? A. Neural tube defects, B. Placental insufficiency, C. Hydrocephalus, D. Intrauterine growth retardation. The answer is A. Neural tube defects. A child with rheumatic fever is having severe pain, tenderness, and swelling in the left joint. What should the nurse do to alleviate this pain? A. Apply heat to the affected joint, B. Put the joint in flexion position, C. Apply cold compress to the joints, D. Ask the child to walk for 15 minutes. The answer is C. Apply cold compress to the joints. A 28-year-old patient in the medical ward was admitted to roll out her recurrent headache for the last year. On the second day of her admission, she complains of severe generalized headache. After identifying the intensity, duration, and severity, the nurse informed physician and administered paracetamol and recorded the details in the nursing notes. After half hour, when the nurse asked the patient replied that the pain was relieved and she felt better. What is the nursing process step? A. Nursing problem. B. Implementation. C. Assessment. D. Evaluation. The answer is D. Evaluation. A physician has ordered the vag feeding every 4 hours for a 12-week-old infant with failure to thrive. In order to know how to insert the feeding tube, the nurse should measure the distance from which of the following? The answer is the tip of the infant's nose to the ear and then to the xiphoid process of the sternum. A 7-year-old child is admitted to pediatric medical ward. His urine urinalysis results revealed massive proteinuria. The child was diagnosed with nephrotic syndrome. Which of the following medication can prevent the relapses of the child condition? A. Antibiotic. B. Corticosteroids. C. Diuretics. D. Immunosuppressive. The answer is D. Immunosuppressive. Rituximab, an immunosuppressive drug, anti-cancer, decreases the risk of relapse in children with frequently relapsing nephrotic syndrome or FRNS or steroid-dependent nephrotic syndrome. Infant mortality is a critical indicator of children's health status. Which of the following statements probably describes the infant mortality term? A. Death of infant during the first year of the life per 100 live birth. B. Death of infants during the first year of life per 1,000 live birth. C. Death of infants during the first year of life per 10,000 live birth. D. Death of infants during the first year of life per 100,000 live birth. The answer is B. Death of infant during the first year of life per 1,000 live birth. Registered nurses must be able to measure blood pressure accurately. What could possibly result in incorrect high blood pressure reading? A. Bladder cuff is too wide. B. Cuff is deflated too quickly. C. Cuff is wrapped too loosely. D. Arm is above the level of the heart. The answer is C. Cuff is wrapped too loosely. A 6-year-old child diagnosed with sickle cell anemia is admitted with severe pain in upper and lower extremities. Which of the following priorities show the nursing concern? A. Hydration and pain management. B. Nutrition and restricted hydration. C. Nutrition and manage infection. D. Manage pain and infection. The answer is A. Hydration and pain management. A 2-year-old girl is hospitalized with diagnosis of bronchiolitis. She is receiving oxygen therapy. Which of the following would be the best indicator for the effectiveness of the oxygen therapy? A. Oxygen saturation of 84%, oxygen saturation of 90%, respiration rate of 12 beats per minute. D. Respiration rate for 25 beats per minute. The answer is B. Oxygen saturation of 90%. A patient was on regular dose of haloperidol. The nurse noticed that he starts developing side effects in the form stopped posture with shuffling gait and pill rolling movement of his hands. Which of the following is most likely the side effects? A. Akathisia. B. Acute dystonia. C. Tardive dyskinesia. D. Pseudo-Parkinsonism. The answer is D. Pseudo-Parkinsonism. A nurse is carrying a 1-year-old child with congestive heart failure. Which nursing goals appropriate? A. Relieving pain. B. Improving myocardial efficiency. C. Maintaining thermoregulation. D. Promoting oral feeding. The answer is B. Improving myocardial efficiency. A patient was brought to the emergency room because of sudden onset of difficulty in breathing. The result to a stat X-ray revealed fluid accumulation in the pleural space. The doctor ordered for an immediate thoracentesis. Which of the following sites should be prepared? A. Between 5th and 6th. B. Between 6th and 7th. C. Between 7th and 8th. D. Between 8 and 9. The answer is C. Between 7th and 8th. A 60-year-old man with gout visited to the medical clinic and advised to increase fluid intake. Which of the following is the benefit of increasing fluid? A. Decrease inflammation. B. Increase calcium absorption. C. Promote the excretion of uric acid. D. Provide a cushion for weakened bones. The answer is C. Promote the excretion of uric acid. Which of the following pain assessment scale is the most appropriate for a 7-year-old boy who twisted his ankle while playing football at school? A. Numeric. B. Behavioral. C. Wong-Baker's phases. D. Simple descriptive. The answer is C. Wong-Baker's phases. During the working phase of the helping relationship, the patient was crying while disclosing his problems to the nurse. Then, in the middle of their conversation, the patients become silent. Which of the following should the nurse do? A. Ask question. B. Introduce another topic. C. Stay with client and be silent. D. Terminate session immediately. The answer is B. Introduce another topic. Which of the following patient care plan is the most appropriate for a 37-year-old post-appendectomy woman who is at risk for pneumonia? A. Restrict fluid intake. B. Teach how to use spirometer. C. Encourage ambulation as tolerated. D. Avoid coughing and deep breathing. The answer is C. Encourage ambulation as tolerated. During the night shift routine rounds, a nurse found that a patient complained of sleep disturbance due to frequent voiding several times at night. Which of the following is the best condition that describes the patient's complaint? A. Dysuria. B. Polyuria. C. Nocturia. D. Hematuria. The answer is C. Nocturia. A 29-year-old woman is receiving an intravenous infusion of 5% dextrose in 0.45% sodium chloride. The intravenous line had been started 1 day prior, and now the patient complains of tenderness at the site. On the examination, the site is pink, colored, swollen, and tender to touch. Which side effects of intravenous infusion problem is most likely? A. Infiltration. B. Phlebitis. C. Catheter sepsis. D. Air embolism. The answer is B. Phlebitis. A 25-year-old woman presents to the emergency room with acute gastritis and signs of moderate dehydration. Which of the most appropriate nursing diagnosis? A. Infection. B. Fluid volume deficit. C. Activity intolerance. D. Fluid volume excess. The answer is B. Fluid volume deficit. A 2-year-old child is admitted to pediatric ward. The mother cannot stay the child and she will visit him in the weekdays only. Which of the following nursing action indicates an understanding of the emotional needs of this child? A. Give her warm bath to calm down. B. Allow the child to suck on pacifier. C. Ask the parents to bring the child's favorite toy. D. Tell the parents that frequently visiting is unnecessary. The answer is C. Ask the parents to bring the child's favorite toy. A conflict occurred for a patient with chronic renal failure with regards to the patient's needs, family needs, the physician's advice, and the hospital policies and rules. What is the first commitment for the nurse who provides care for the patient? A. Physician. B. Hospital. C. Family. D. Client. The answer is D. Client. A 5-year-old child brought to the emergency room with fractured right forearm. He had several bruises on his body, but showed no signs of pain while palpating them. Seemed scared and did not answer any questions asked. Which of the following should the nurse do to gain the child's body trust? A. Arrange meal. B. Comfort measures. C. Show the playing area. D. Therapeutic communication. The answer is C. Show the playing area. A nurse accidentally dropped a medication ampule, informed the charge nurse, and completed the incident report form. Which of the following best describes the nurse role? A. Responsiveness. B. Timely decision-making. C. Profession accountability. D. Abiding by moral obligation. The answer is C. Profession accountability. The patient is receiving potassium-sparing diuretics should be monitored. Which of the following? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypercalcemia. The answer is B. Hyperkalemia. Patient diagnosed with vitamin C deficiency. Which of the following foods would the nurse most likely instruct the patient to add to? A. Broccoli, tomatoes, strawberries, and potatoes. B. Legumes, eggs, oats, and meat. C. Yeast, fish, bananas, and nuts. D. Milk, liver, rice, and beans. The answer is A. Broccoli, tomatoes, strawberries, and potatoes. During clinical assessment, the nurse suspected that a child has been psychologically abused. Which statement by the child is most likely support the suspicion? A. My parents tell me that I am stupid. B. My parents hurts me to get attention from the doctors. C. My mother forces not give meals on time. D. My uncle show me picture of nude people. The answer is A. My parents tell me that I am stupid. While a nurse is assessing a vital signs of newborn infant, the first hour of delivery, the heart rate is 170, the RR is 70, the temperature is 36. The nurse would interpret this finding as the discharge instruction: A. Anemia. B. Cold distress. C. Heart defects. D. Hyperglycemia. The answer is B. Cold distress. A 30-year-old married woman has dilatation and curettage as a therapeutic abortion. A nurse was preparing for discharge instruction. Which of the following should the nurse include in discharge instruction? A. Taking high-protein diet. B. Use tampons during swimming. C. Avoid sexual intercourse for 2 weeks. D. Continue bed rest for 2 weeks at home. The answer is C. Avoid sexual intercourse for 2 weeks. Which of the following is the study of interactions or relationship between living organism and their environment? A. Ecology. B. Pathology. C. Microbiology. D. Parasitology. The answer is A. Ecology. A 6-year-old preschool returned from the operating room after tonsillectomy. A nurse received the patient from recovery. Which position the nurse placed the child post-tonsillectomy? A. Supine. B. Side-lying. C. Low Fowlers. D. High Fowlers. The answer is B. Side-lying. A child with thalassemia was given desferoxime or desferal. Which of the following should alert the nurse to notify the physician? A. Decreased hearing. B. Hypertension. C. Red urine. D. Vomiting. The answer is A. Decreased hearing. Deferoxamine, signs and symptoms: muscle twitching, shortness of breath, nausea, diarrhea, confusion, hearing problems, skin rash, decreased urine output, and seizure. Which of the following should be included in the nursing care to a woman during second stage of labor? A. Shave the perineum. B. Administer enema to the woman. C. Careful evaluation of perinatal history. D. Watch breathing, bear down with each contraction. The answer is D. Watch breathing, bear down with each contraction. The nurse who is planning to discharge education should instructed the caregivers that during hypercyanotic spell, which position is the most likely to benefit the child? A. Supine. B. Prone. C. Side-lying. D. Knee-chest position. The answer is D. Knee-chest position. A mother is asking the nurse how a sickle cell could be detected. Which of the following is a test-detected sickle cell disease or traits? A. Hemoglobin electrophoresis. B. Bone marrow aspiration. C. Complete blood count. D. Free erythrocyte protophorin. The answer is A. Hemoglobin electrophoresis. Hemoglobin electrophoresis, this is measures hemoglobin levels and looks for abnormal types of hemoglobin. If your hemoglobin type levels are too high or low, it could be a sign of a hemoglobin disorder. A nurse was assigned to facilitate a group therapy for a group of patients with cluster personality disorder. Which of the following should have first nursing intervention? A. Avoid self-mutilation. B. Provide adequate nutrition. C. Build a therapeutic relationship. D. Give health education about medication. The answer is C. Build a therapeutic relationship. The antenatal clinic nurse was assisting a 32 years old Gravida 2 Para 1 pregnant mother on the fundal height at 36 weeks. What is the expected fundus position? A. Umbilicus. B. Xiphoid process. C. Scfhs pubis. The answer is B. Xiphoid process. A woman is at 30 weeks of gestation age admitted to the antenatal with premature rupture of membrane. The nurse administered dexamethasone to her according to the doctor's prescription. She was asked what is the drug for. Which of the following is the best answer? A. To promote fetal lung maturation. B. Prevention of chorioamnionitis. The answer is A. To promote fetal lung maturation. A modifiable risk factor are those aspects of person's health risk over which he or she has no control. Which of the following is considered a non-modifiable factors? A. Genetics. B. Smoking. C. Eating. D. Activity. The answer is A. Genetics. The nurse is caring for a patient who has not had bowel movement in the past few days and is suspected of having a fecal impaction. Which of the following intervention confirmed fecal impaction? A. Hema-occult blood test. B. Digital examination. C. Valsalva. D. Squat test. The answer is B. Digital examination. A nurse is reviewing blood chemistry result of a client with magnesium result of 1.7 and the normal is 0.7 to 1.2. Which of the following symptoms the nurse is monitored? A. Trousseau sign. B. Depressed respiration. C. Elevated blood pressure. D. Increased tendon reflex. The answer is B. Depressed respiration. A 62-year-old patient present to the emergency department and complains of muscle cramps, nausea and vomiting and fatigue. The temperature is 45 and had been working outside day all under the sun. He says that his fingers are numb and cannot feel anything with BP of 106/58, heart rate of 99, temperature of 37.4. Which of the following electrolyte will be below the normal range? A. Chromium. B. Magnesium. C. Potassium. D. Bicarbonate. The answer is C. Potassium. A 53-year-old man is diagnosed as HIV positive. He had a history of on and off diarrhea and progressive weakness for the past few months. He has endoscopy. Which of the following measures should the healthcare providers evaluate? A. Reverse isolation and optimum nutrition. B. Confidentiality and support system. C. Health maintenance and follow-up regimen. D. Family screening and prevent spread of infection. The answer is A. Reverse isolation and optimum nutrition. A 55-year-old male has a myocardial infarction requiring admission to the hospital. He is being treated with anticoagulant. The healthcare provider could be most concerned about which of the following? A. Trouble sleeping. B. Nausea. C. An elevated creatinine. D. Purpura. The answer is D. Purpura. The idiopathic thrombocytopenic purpura is a signs and symptoms in anticoagulants receiving patients from myocardial infarction. It is a rash or of purple spots on the skin, joints, and etc. due to leakage in the small blood vessels, easily bruising, bleeding gums, or intestinal bleeding. A 52-year-old woman is scheduled to undergo an abdominal perineal resection in the third day for removal of a cancer of the rectum. The nurse reviewed the care plan with the patient. The patient will receive prophylactic antibiotics and will be given a mechanical bowel preparation the day before. Which additional preparation should the patient undertake in this time? A. Wear pressure stocking. B. Perform leg strengthening exercises. C. Maintain high protein, low residual diet. D. Take daily ferrous iron tablets. The answer is C. Maintain high protein, low residual diet. A 40-year-old man was admitted to a male medical department with pneumonia. A nurse in the department explained and obtained informed consent for the chest CT scan procedure with contrast. Which of the following ethical principles underpinning informed consent? A. Autonomy. B. Non-maleficence. C. Beneficence. D. Respect. The answer is A. Autonomy. A patient with skeletal traction and with urinary catheter were discontinued for a patient who was immobilized in traction for 6 weeks. The patient developed a problem with urinary incontinence. Which of the following is the most appropriate intervention? A. Scheduled toileting. B. Bladder retraining. C. Promoted voiding. D. Behavioral training. The answer is B. Bladder retraining. A patient presents to the clinic with positive 3 edema of the lower extremities. Diagnose neck veins distension, tachycardia, bounding pulse, weight gain of 4 kilograms in 7 days, shortness of breath, and wheezing. Fluid intake over the past 24 hours has been 3,700 ml and the output is estimated at 2,400 ml. Which of the following is the most likely nursing diagnosis? A. Fluid volume exists. B. Urinary tract infection. C. Hypothyroidism. D. Ketoacidosis. The answer is A. Fluid volume exists. A nurse inserted an intravenous cannula into a patient's right forearm and began to administer 500 mg of erythromycin through a pump delivery system. Following hospital protocol, the nurse remains at the bedside for the first 10 minutes to assess the patient's response. After 5 minutes of the infusion, there is a small hematoma at the cannula insertion site. The intravenous injection flow slower than expected when the arm is elevated. The skin proximal to the catheter site is warm, reddened, and painful on palpation. Which of the following is the most appropriate nursing action? A. Apply ice pack for 20 minutes at the site. B. Discontinue and re-establish a new site. C. Increase infusion of the pump. D. Position right hand below level of the heart. The answer is B. Discontinue and re-establish a new site. A patient is being prepared for discharge following hip replacement surgery. The nurse is providing him with discharge education. Which of the following information should be taught to him as an effective pain management principles? A. Avoid giving pain medication prior to participating in physical therapy. B. Give a double dose of pain medication if pain is intolerable. C. Give pain medication before pain becomes severe. D. Delay giving pain medication as long as possible. The answer is C. Give pain medication before pain becomes severe. A nurse reviewed a chart of a 42-year-old man whose ABG analysis reports is shown. pH of 7.20, the PCO2 of 35, the bicarbonate is 20. Which of the following is the most likely interpretation of the findings in the report? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. The answer is D. Metabolic acidosis. The Mantoux test is done for a patient. Result was 6.5. It considered is latent. B. Suspected. C. Active. The answer is B. Suspected. A urinalysis is best evaluated for accurate results if the specimen is analyzed within which of the following? A. 1 hour of collection or refrigerated until analyzed. B. 1 hour of collection or left at room temperature. C. 2 hours of collection. D. 4 hours of collection. The answer is A. 1 hour of collection or refrigerated until analyzed. A pregnant mother is in the active labor. Her cervix is fully effaced, dilated with crowning of the fetal head. The mother is exhausted, perspiring, and is having increasingly painful and severe uterine contraction. Which of the following intervention is best desired by the assisting midwife? A. Exert pressure on abdomen to aid in childbirth. B. Increase the rate of intravenous medication. C. Wipe face with wet towel and hold hands. D. Instruct mother to push harder. The answer is D. Instruct the mother to push harder. An infant with developmental dysplasia of the hip is discharging with a pelvic harness. Which of the following instructions should the nurse give to the infant's parents? A. Put the baby's diaper over the harness. B. Fasten the strap for at least 2 hours every day. C. Press both legs together before applying the harness. D. Soft, thin clothing should be worn under the harness. The answer is D. Soft, thin clothing should be worn under the harness. Wassermann reaction test is for syphilis. A nurse is assigned to care for a patient with physical immobility due to right knee injury. The nurse is preparing to write nursing diagnosis. Which of the following is the priority nursing diagnosis? A. Pain. B. Hygiene. C. Dehydration. D. Skin integrity. The answer is D. Skin integrity. What will happen to the patient if whole blood transfuse exceeds 4 hours in room temperature? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypernatremia. The answer is B. Hyperkalemia. A toddler is admitted to the hospital with acute laryngitis. Respiration is 50. 38.7 is the temperature. Which of the following is the most priority nursing intervention when child's caring for? A. Decrease stimulation to promote rest. B. Monitor the toddler's temperature. C. Frequently assess respiratory status. D. Clean the nares with bulb syringe. The answer is D. Clean the nares with a bulb syringe. Immediately after delivery of the placenta, the mother starts bleeding profusely from the birth canal. Which of the following is the nurse's immediate action? A. Administer oxygen by face mask. B. Monitors vital signs continuously. C. Increase the rate of intravenous infusion. D. Rubs the fundus to stimulate contraction. The answer is D. Rubs the fundus to stimulate contraction. Postpartum psychological phase sequence. A. Taking in, taking hold, letting go. B. Taking in, taking hold, letting hold. C. Taking hold, taking in, letting hold. D. Letting go, taking hold, taking in. The answer is A. Taking in, taking hold, letting go. Which of the following statement indicate nursing action during the first hour after delivery of the placenta? A. Monitor of mother's hemoglobin. B. Assess maternal vital signs every 15 minutes. The answer is B. Assess maternal vital signs every 15 minutes. A 19-year-old girl was scheduled for the extraction of her wisdom teeth under general anesthesia. Her preoperative anesthesia consultation was done and the consent was signed by her, but she refuses to remove her nail polish and trim her long nails. Which was the necessary requirements? Why is it necessary to have unpolished and trimmed nails as one of the requirements before the general anesthesia? A. Avoid puncturing the inner side oxygen probe. B. Prevent chipping or crutches from long tube. C. Assess for nail color during anesthesia. D. Follow the pre-anesthesia protocol. The answer is C. Assess the nail color during anesthesia. A 52-year-old man was working in the tall grass when a snake bit him. The ambulance arrived at the scene 20 minutes later. They found the man lying on the ground with cold and clammy skin. He was having difficulty breathing and the right ankle was swollen. He complained double vision, feeling weak and itching of the skin. He reported that he was being bitten by the snake. The paramedics prepared to administer intramuscular epinephrine and place a tourniquet. The blood pressure is 86/48. The pulse rate is 130 beats per minute. The respiratory is 28. Which of the following nursing diagnosis has the highest priority? A. Disturbed sensory perception related to the effects of pruritus. B. Ineffective breathing pattern related to bronchospasm. C. Decreased cardiac output related to systemic vasoconstriction. D. Risk for injury related to drug treatment and adverse effects. The answer is B. An affected breathing pattern related to bronchospasm. The nurse is placing a nasogastric tube in a patient for enteral nutrition. Which of the following action must be the nurse consider prior to give feeding to verify the placement? A. Palpating the abdomen. B. Aspirating and testing the contents. The answer is B. Aspirating and testing the contents.